The community nursing service is made up of 6 large community teams. We all cover different areas of Bristol, and we work within those large teams to see patients in their own home. They're people who aren't able to get out and about to access treatment elsewhere in clinics. So what makes this job really interesting is because we get to see quite a wide variety of patients in their own homes. And by that I mean we see a lot of people with complex nursing needs. So you're not just treating one patient with one problem, you're often treating many different problems. And that can make it quite a challenging role, but also keeps the job really interesting. I think BCH is a brilliant organisation, and it's certainly the best place that I've ever worked. One of the main reasons I think this way is because of the career opportunities. There's just so many areas that you can choose to develop into, and I think that's brilliant.
Working in the community gives you a truly holistic environment because you're able to assess the patient in their own home, to take in factors that you wouldn't necessarily be able to see in the hospital. Things like their families and their involvement, their diet, their lifestyle, things that can affect and change your plan of care. I joined 11 years ago as a Band 5 community nurse. Bristol Community Health supported and funded my specialist practice qualification in district nursing.
On a typical day, I would come into the office in the morning, be greeted by all my team members. We go out onto visits to see patients, which can be completely varied, anything from wound management to administration of medications. The role is very varied and every day is different.
I've previously worked in the hospital. Working in the community setting's very different. You get to work with people on a one-to-one basis, and you can involve them in the planning and assessment stages of their care. Shared decision making is really important in the community.
I think the difference between working in an acute trust and working in the community is that in the acute, you don't really get to know the patients for that long. In the community, you get to know them over a long period of time and get to know them on a personal level, which is really enjoyable.
The most rewarding thing about my role is the impact we have on patients' lives. A lot of the feedback that we've received from patients and their families, they do refer to us as angels, which makes it all worthwhile.
A good community nurse needs to have good communication skills, needs to be a good team player. You work autonomously, but you also need to work as a member of the team.
I think anyone can be successful within Bristol Community Health. I think you need to seek the opportunities that are here because there's plenty of them, and you will 100% be supported to do that.